Multiple tooth restoration. The multiple tooth restoration is used when two or more adjacent teeth are missing. Implants are placed at the site of each missing tooth. Depending on the location of the implants, they may be placed at a slight angle to take advantage of as much available bone as possible. The implant may be left to heal for up to 2 weeks or for a few months, depending on bone quality. Following healing, titanium posts are screwed into the implant bodies. Restorations are then attached to the abutments with dental cement or screws. In cases when 3 adjacent teeth are missing, it may be possible to place only 2 implants, one on each end. Similar to the previous procedure, titanium posts are screwed into the implant bodies, and restorations are attached to the abutments. In this scenario, an implant-supported bridge is used to provide the functionality and create the appearance of a 3-implant procedure at the reduced time and cost of a 2-implant treatment. If you are missing multiple teeth, an implant-supported bridge may be the best solution for you. Implant-supported bridges can provide the following advantages over traditional treatment options. Provide comfort and stability. Look, feel, and perform like your natural teeth. Do not compromise adjacent teeth to support a bridge. Help preserve surrounding bone by replacing the tooth root. Attach securely to implants. Help prevent bone loss and jawline recession. Restore a more secure biting ability than a removable denture. Eliminate recurrent wear and chance for decay around prepared teeth. Improve appearance and self-esteem. Require similar oral care as a natural tooth.